This is how to suction a patient with a tracheostomy. First, I will begin with checking my patient's orders. It's necessary to have a physician order to suction a patient with a trach, and I see that my patient has an order to suction every 2 hours in PRN. I'm going to enter into my patient's room. I'm going to introduce myself, wash my hands. I want to have my patient's chart, and I'm going to, because he cannot speak with this trach, check his identification bracelet, his name and his birthday and medical record number. Because I'm going to be dealing with secretions, wear PPE, and so I have a yellow gown on today to protect myself, and a mask with a face shield to protect my eyes. For demonstration purposes, so that you can hear me, I am not going to be wearing my mask with my face shield. The supplies that I will need for this procedure are a suction catheter kit and a bottle of normal saline. My sterile gloves are in my kit, but I also will need non-sterile gloves. I also need an ambu bag. The ambu bag administers 100% oxygen as well as ventilations to my patient. You also need to have workable suction, either via a wall unit or portable suction. I have portable suction today. You want to turn it on and make sure that it's working correctly. The limit should be from 100 to 150, or check your hospital policy. I'm going to explain to my patient what I'm going to be doing, and I will get started. I want to do a full respiratory assessment on my patient before I suction them. I'm going to check their respiratory rate, which I can measure using my watch, or I can check on my patient's monitor, and his respiratory rate is 12. My patient today also has continuous pulse oximetry. The pulse ox probe is on his finger, and I am able to monitor this value on my monitor as well. I want to listen to his lungs anteriorly and posteriorly. And we always listen under clothing. I would turn my patient and listen posteriorly. I have my normal saline. I want to check the expiration date. This is a brand new bottle, so once I open my normal saline, I am going to date, time, and initial it. It is good for 24 hours. I have a drape that I'm going to drape across my patient just to protect their gown. Now I will open my kit and set up my supplies. First, I'm going to remove my cup from my normal saline. You can open it by touching the outside. There's a plastic liner in it. I'm going to set it to the side. And I will open my normal saline and pour it in. Now I will go ahead and open my kit. I'm opening my kit in a sterile fashion. It's in front of me. I'm only touching the 1-inch border of my packaging. I will don my sterile gloves. Now my hands are sterile. Because I'm right-handed, I will designate my right hand as my sterile hand and my left hand as a non-sterile hand. Before I suction my patient, I am going to give them some oxygen to increase their oxygenation. So I will begin by, with my non-dominant hand, moving their trach collar to the side, taking my ambu bag, attaching it to the trach, and giving approximately 3 to 6 breaths, monitoring my patient's oxygen pulse oximetry. Now I will attach my suction catheter to my suction. I can check and make sure that the suction is working. Now what I'm going to do is I'm going to attach the end of my suction catheter to my suction tubing at the connections. And take the wrapper off my suction catheter. I'm very careful not to let my catheter fall and become contaminated. I will test that my suction is working by putting the tip of my suction catheter in my normal saline. With the thumb of my non-dominant hand, I will cover the opening of the suction catheter, and that is what applies the suction. I'm ready to suction. Again, I'm checking my patient before I start suctioning, noting their respiratory rate and pulse oximetry. With my non-dominant hand, I will move the trach collar to the side. With my dominant sterile hand, now insert my suction catheter into my patient. I'm going to insert my catheter until I just meet resistance. And that means that I'm touching the carina. I will withdraw the catheter approximately a ½ inch to an inch, and then apply suction intermittently with my non-dominant hand. I want to monitor my patient, how they're tolerating this, how their oxygenation is, and looking at my suction catheter, noting the type and the amount of secretions. Then with my non-dominant hand, I will put my trach collar back. I'm now going to take my catheter to my normal saline and apply suction to clear my line. And I may repeat if necessary if my patient continues to cough or I can hear secretions. At this point, my patient sounds clear and is not coughing any longer. So I am going to dispose of my catheter by coiling it in my dominant hand, removing it from the suction tubing. As I'm doing this, I'm noting my patient at all times that their respiratory status is stable, that their pulse oximetry is within normal limits. I'm now going to dispose of my catheter by disposing of it inside my glove and throwing in a trash container. It's necessary to do a full, complete respiratory assessment on my patient after I have suctioned my patient. I am going to check the respiratory rate again, either by counting it or checking the monitor. I want to note their pulse oximetry reading, which is 98, and I'm going to listen to their lungs. My final step will be removing my gown and washing my hands.